Hi everyone. Thank you for the opportunity to present findings from our study. My name is Oluwasegun Akinyemi. I'm a senior research fellow at the Howard University College of Medicine. Today I will be talking to you on factors associated with recommendations for surgery in early stage pancreatic cancer. We have no disclosures. Pancreatic cancer remains one of the most lethal malignancies in the United States, with a yearly incidence of more than 60,000 and close to 50,000 of these patients dying of the disease. It is indeed a devastating condition. And the only definitive curative approach is complete surgical resection. However, despite the critical role of surgery in managing these patients, we observe significant disparity in patients receiving or being recommended for surgery. So the objective of our study was to investigate factors that are associated with recommendations for surgery among patients who present with early stage pancreatic cancer. And we utilized the SEER registry and identified these factors using a multivariate logistic regression, controlling for patient baseline characteristics and also treatment modalities. Here we highlight baseline characteristics of these patients. We have most of these patients were the median age of 65, predominantly male, and the largest proportion of these patients were white, with a small proportion of the patients being blacks or Hispanics. However, if you focus on the survivor, we notice a significant difference between patients who were recommended for surgery and those who were not, with the best survivor among patients who were recommended for surgery, such that 1 year survival among patients who were recommended for surgery was 77.2 compared to 27.2 among those who were not recommended for surgery. And the 10-year survival rate was about 32% for patients who were recommended for surgery and only 2.9% for patients who were not recommended for surgery. So looking at these factors, we conducted our multivariate regression and predicted the odds or the probability of an individual, a particular race or ethnicity being recommended for surgery. And we see that compared to virtually all the other race or ethnicity, Black, non-Hispanic blacks were less likely to be recommended for surgery. So we of course shows that we know that recommendation for surgery is a major factor that determines who gets surgery. And looking at our Kaplan-Meier curve, unexpectedly, of course, we saw the best survivor among patients who were recommended for surgery. In conclusion, the present study reveals significant racial disparities among surgical recommendations for surgery among patients who presented to the hospital on account of early stage prostate cancer. And we found out that patients who were blacks were less likely to be recommended for surgery in the study cohort. Thank you. I will be happy to answer your questions.
All right. I guess I have a lot of questions, but did you have any data on comorbidities? Whipple is not a small procedure, right? And so is any information on functional status or comorbidities included?
So that is the major limitation of using the SEER database, because we are not able to actually adjust for morbidities, pre-existing comorbidities, because there are no variables in the SEER database that actually measure that. So that's a big limitation for our study.
Is there a way to capture that, like with a SEER Medicare type study with claims-based data, potentially?
Yes, there's a possibility of a linkage, but which we did not do in this study.
Okay.
Yeah.
And was this, when you say they were recommended for surgery, there's a specific variable in SEER that says we recommend surgery?
Yes.
Okay.
Yes, there is.
Can you talk a little bit about what the definition is of early stage pancreatic cancer for this study? Like exactly how was it defined?
Yeah, so for the early stage pancreatic cancer, this we define as patients who present with a stage of either stage 1 or stage 2A.
Great, good job, thank you.
Thank you.
Thank you.